Welcome to this edition of the First Aid Show. Today we're going to discuss the prostate, as it's often forgotten as something that needs to be checked by men, and this is usually due to lack of knowledge, denial or embarrassment. There are many adverts and campaigns on TV encouraging men over the age of 50 to be more aware of their prostate health. The adverts are not trying to scare men, they're trying to make prostate something that men can talk about without embarrassment. The NHS website has some excellent advice on the prostate and the problems that can occur, and we're going to refer to some of this content in this video. The other good source of information is Prostate Cancer UK. All men have a prostate. It's important for their sex life, but few men know anything about their prostate or what can go wrong with it. According to a survey of men aged 45 and over by Prostate Cancer UK, 70% of them knew nothing about their prostate or the symptoms of prostate problems. The prostate is located just below the bladder. It produces some of the fluid in semen and is crucial to a man's sex life. It's about walnut sized, and the prostate fluid nourishes and protects the sperm during intercourse and forms the bulk of the ejaculate volume. The prostate often enlarges as men get older, but for 2/3 of men aged 50 or over, this doesn't cause any problems. In some cases, an enlarged prostate can press on the tube carrying urine from the bladder and can cause urinary problems. This is known as benign prostatic hyperplasia, or BPH. Other prostate conditions include the inflammation of the gland, also known as prostatitis, which is sometimes caused by an infection. This can make urinating painful. Sometimes a single cell in the prostate starts to multiply out of control and cancer can develop. The big fear among men is prostate cancer. Prostate cancer is the most common cancer in men in the UK, with more than 30,000 men diagnosed annually. Around 10,000 men die from it every year, making it the second most common cause of cancer deaths in men after lung cancer. The problem is that we're told that early detection is vital for treatment, but most men with early prostate cancer have no symptoms at all, making this a very low priority with men. Some of the symptoms of prostate cancer can be also caused by other prostate problems, like needing to urinate often, especially at night, difficulty in starting to urinate, straining to urinate or taking a long time to finish, or pain when urinating or during sex. Other less common symptoms include pain in the lower back and blood in the urine. Many men over 70 have prostate cancer, even though most of them will never ever be diagnosed or have any symptoms. In about 80% of cases, this is a slow-growing cancer, and it may stay undiagnosed because it never caused any symptoms or problems, and they die from other causes before the cancer is actually a problem. In the other 20% of cases, the prostate cancer cells can grow quickly and move outside the prostate, spreading the cancer to other parts of the body, such as the bones. The risk of getting prostate cancer gets higher as you get older. Most men are diagnosed with the condition at over 50. However, survival rates of newly diagnosed prostate cancer patients has improved from 30% in the 1970s to 80% today. If you have a father or a brother diagnosed with prostate cancer, your risk of getting the disease is 2.5 times higher compared with the average man. The risk increases to 4.3 if the relatives were diagnosed before the age of 50, and 3 times higher if they come from an African or Afro-Caribbean background. Researchers believe a diet high in saturated animal fats and red meat may be responsible for the high incidence of prostate cancer in Western countries. It's thought that reducing your intake of animal fat and eating more fruit and vegetables may lower the risk of prostate cancer developing or spreading. There is currently no prostate cancer screening program on the NHS. It's up to the individual if they want to get tested. But too many men are often put off by going to their GP if they develop symptoms because they're afraid of the diagnosis of prostate cancer. So what can you do to get checked? This is simple and easy. Go to your doctor and tell them you want your prostate checked. They'll ask you a few questions and then check you, which is, although it's a little embarrassing and uncomfortable, it's quick and painless, and the check will give you instant results. The doctor is feeling for an enlarged prostate with a finger through your back passage. If they detect a problem, they may do urine or blood tests or refer you to a specialist, but this does not mean you have cancer. There are many other causes, including infections, cysts, or damage from an injury you may not have noticed. Finally, you may have agreed with this video and thought you need to get checked, but your problem is asking the doctor. Just do it. Their job is to discuss things like this. They're used to people not knowing how to say what they mean. If you think this will be a problem, write it down and hand the note to your doctor. They are very good at making you feel at ease. We'll look at this in more detail in later editions of the First Aid Show and look at what tests could be done if they find a possible problem.